do you want me to wait a minute or two? Like, should I just go ahead and tell people that we're letting people into the room once they start filtering in?
Yeah, that sounds good. And then we can tell them just to use the chat if they have any questions, and then you can incorporate them as you normally do.
Okay, perfect. Dara, you ready?
Ready.
Okay, good. Good afternoon. I am Dr. Richard Pineda, the host for the Burrell College of Osteopathic Medicine Diversity Series. And it is a pleasure to welcome you to the first of our series for 2021. Lots of familiar faces and a few new folks. You'll notice that we changed times, largely in an experiment to see if moving to the evening or late afternoon would bring in some more folks, maybe that are balancing out class time and work time with everything else. So we'll try this. If you like it, let us know. If it doesn't fit your schedule, also let us know so we can figure out if we want to move back to a lunchtime schedule. So for those of you that are new to the diversity series, the point of having these different conversations came out of a conversation that I had with President Hummer, talking about the idea that there are a number of pressing issues, both in medical education and in the practice of medicine, that are connected to issues of diversity and the presence of diverse workforces, and certainly the shift to the population in medical school. So diversity has increased, and so have patient needs once our medical students are out in the field. And so as a result of that, we've had a number of conversations that focus on issues of diversity, both directly and indirectly. And today's conversation is a combination of both of those things. We're going to be talking about mental health, and in particular, some of the issues related to how that is a particularly significant issue in the conversation about the practice of medicine in a pandemic-based world, but also talking about the perspectives with two guests who have a unique insight, not only to the nature of diversity from their own backgrounds, but also in terms of the practice both in the healthcare world and in the world of health and wellness. As a reminder, we do have an open chat for questions, and what I will do is monitor those. So if you do have questions, feel free to put them into the chat, and I can pose the question to our two guests today. But without further ado, I wanted to welcome two guests, one virtually returning to Burrell, Dr. Joya Singh, who is an emergency medicine doctor at Parkland Hospital in Dallas, and also a graduate of the Burrell College of Osteopathic Medicine, and Dara Parker. Dara is the owner of Dara Parker Health and Wellness, and is coming to us today to talk not only a little bit about the nature of health and wellness in this particular time, but also to offer some practical insights into things that you can do and also think about in changing your outlook. So it's great to see both of you here, and Joya, a virtual welcome back to the virtual BCom setting. So why don't we start with you, Joya? I think a lot of your faculty probably recognize you and are happy to see you. But tell us a little bit about how you first ended up at Burrell, and secondly, how you ended up at Parkland and what you do.
Thank you so much for having me, Dr. Pineda. It's such a joy and a pleasure to be back and to see some familiar names on the screen. Thank you for having me. So a little bit about me. I was born in Nepal, moved to Dallas with my family when I was around 8 years old. So I grew up in Dallas. Growing up in Dallas, I really saw how a robust county health system can make an enormous impact in the members of Dallas County. And even if like national healthcare system is lacking, a robust county healthcare system can really fill in those gaps when used appropriately. And so my dad had a stroke in 2008. And at the time, it was such a traumatic experience for my family. He's totally okay now, but a traumatic experience for my family at the time, which is really what kind of pushed me right into the world of medicine. And I became very familiar with the Parkland healthcare system with my dad, because that's the hospital the ambulance took him to. Luckily for my family, it happened to be a county healthcare system, and my parents didn't go absolutely bankrupt with his healthcare. He was in the ICU for a month. And so I just the whole like county healthcare system became very personal to me. I became intertwined with it very personally. So I got thrown into the world of medicine through that experience. I knew I wanted to be a doctor after that. And then I came to Burrell. It's kind of a funny story. So I did a master's after undergrad, and one of my good friends that I did master's with, Dr. John Rajala, who's also an alum as well. He was in my class. John and I were really good friends in grad school. I was doing research at UT Southwestern. After grad school, I did research for a year in molecular biology, researching pediatric rhabdomyosarcoma. And John called me one day and he's like, "Hey, I just applied to this great new school. It's in New Mexico. I think you'd love it. You'd be a great fit." He just started talking up the school all day. He called me 3 times and he's like, "Just apply, Joya. It won't hurt you." And I was like, "John, I'm not applying until next year. Like, I still need to work on my application. I'm finishing my research project." He's like, "Just do it. What is it going to hurt?" And I was like, "Okay, fine." So on a whim, Burrell was the only college I applied to that cycle because I was planning on applying later. And I got in, and it has honestly been the best thing that's happened to me, and it's been great. And so I chose Parkland for the reasons I mentioned above. My family's in Dallas. It's a very near and dear system to me, so I'm very happy to be a part of it and giving back to my community now.
That's fantastic. And just the sort of insight, I forgot this, although you reminded me as you were talking about this. I met Dr. Singh probably in the ways that you don't necessarily want to meet somebody, but she was doing a rotation through infectious disease, and I was actually in the hospital. I was going through a fairly traumatic process, and she was the doc that was alongside my infectious disease doc, and so I remembered that. I just had that moment of thought. Fantastic. Well, we're very, very happy to have you back, even though it's not on campus, but to have us virtually here. Dara Parker is the owner operator of Dara Parker Health and Wellness, and Dara has just a really interesting set of experiences that have brought her to this point. Dara, tell us a little about yourself and how you ended up in the integrated health community.
Sure. Thanks for having me. In 2012, I was teaching. I was actually a high school English teacher and had been teaching for a while. And I was actually bitten by a tick, and I got diagnosed with Lyme disease, and it became pretty chronic. The symptoms were pretty chronic, and went to lots of doctors, and they, would prescribe different medications and try different therapies, and just nothing really made me feel well. And so I started to do some research on my own, and I changed a lot of things about my diet, and changed a lot of things about the way I was moving my body, and just tried all kinds of different holistic practices that I would read about. And I slowly got much, much better. And I would say probably I feel about 90% now. And so I resigned from teaching after 12 years and went back to get a certification in integrative nutrition. And so now what I try to do is help women, support women, mostly women. I've worked with some men, but mostly support women in helping them find movement and nutrition and ways to tap into spirituality that really help them feel well, whole, in a whole health sort of way. So that's what I do now.
Fantastic, perfect. Well, let me start with this sort of overview and go back to you, Joya, with a particular question. There was a recent interview on NPR's Fresh Air with Terry Gross, and she had a chance to talk to Dr. Sanjay Gupta, who was talking about the unique mental health challenges at this particular moment in our kind of collective world. And she said that one of the things that was unique was this was a challenge, the pandemic was a challenge that was being experienced worldwide. And the nature of both the stress and the trauma associated with the pandemic is having this substantial impact on just people's mental health. I'm wondering if you can give us an insight. You and I had a chance to have a conversation yesterday to prep today's talk, and you were telling me a little bit about what it's like to work in an ER at this particular moment. Kind of walk us through that, and sort of give us your insight to what people are experiencing, what you're seeing from your fellow medical professionals.
Sure. Yeah, that's such an important topic at this moment. I see the effects of the pandemic on mental health of my patients, but more so, I think, in my colleagues. So Parkland Hospital is the busiest emergency department in the entire country. I think for like the third or fourth year in a row, we see over 240,000 patients a year. So it's an incredibly busy ED. And working in the emergency department in the middle of a pandemic, it's hard, mostly because we just don't know who has COVID. And a lot of the patients that are there for non-COVID-like symptoms end up having COVID. And so what we were taught at the beginning of intern year when July 1st started was, anytime you go into a patient room, make sure you have your full PPE on. So it's the N95 mask, the surgical mask over it, and then either face shield or goggles. We don't always wear the gown unless we know unless we have a suspicion the patient has COVID, but the face shield and like the face gear is always on. And so that in itself poses a challenge because we're unable to connect with our patients the way that we used to. Just being as a fourth year med student, you know, when I was doing away rotation, seeing my patients in the ED, like just being able to have that small moment of human connection was very important to me. That's one of the things I really enjoyed about working in the emergency department, that just being able to build rapport with my patients within a few minutes of our encounter. But I feel like in the pandemic, my patient's wearing a mask, I'm wearing a mask, I'm standing like more than 6 feet away from them. Normally I'd be right at their bedside, like holding their hand as I'm talking to them or just showing some signs of comfort, but I'm reluctant to do that. And I feel bad even when I'm in full PPE, I don't want to do it. Primarily because I live at home with my parents and I can't live with myself knowing that I unintentionally brought the virus home and then subsequently passed it to them. So just that stress and that burden has been really tough. For my so fortunately, I started my intern year in Dallas, where my whole family, my entire support system is here. So I'm lucky. But some of my other co-interns, they moved from like Michigan, California, some from New Mexico, all over the country, and they have no support system. They have no family members in Dallas. We're having to isolate. We social distance, can't gather in large groups like we normally would when we start intern year. So I know for them, the effect of the pandemic has been very hard. They try to get together in small groups, but you know, you also feel guilty because you're a doctor and you don't want to disobey these rules, but it's been a challenge for sure.
And Dara, let me ask a question sort of in the same line. I mean, with the clients or the women you've worked with right now, I mean, from a mix of backgrounds and your own background. I mean, your husband is a high school educator. How are you seeing stress manifest, and what are people talking to you about, and what are you seeing from the people that you're engaging with? I mean, especially professionals. I mean, what sorts of things are happening, and how are they talking about it?
Sure. I can, I see a lot of the same issues in that I don't see patients, in a hospital, but I have an office and normally they would come to my office and I'd sit across the table from them. And something about when you're talking about your health, you want to be in front of that person because there's so many, confidential things that you're talking about that have to do with how you're feeling and where those things are coming from. And now we're having really most of my clients I'm seeing now via Zoom. If I do see them in my office, we both have masks on. And one of the things that I've noticed is usually women come in thinking they want to see me initially for weight loss reasons. Normally they hear health and wellness And they, you know, the first thing they report wanting to see me about is weight loss. And I'm not a weight loss specialist, and I don't put people on diets. But now what I'm seeing most of all is women coming in with anxiety, high levels of anxiety, feeling like, you know, am I doing enough? Should I be sending my kids to school? There's a whole different set of issues now that are related to health, and they're affecting, you know, we're seeing symptoms now that are not just associated with, you know, weight gain or things like that. We're seeing a lot of things that are associated really with mental health, um, you know, things that have to do with mental health. So,
Dara, do you think that I mean, in the women that you've spoken with, the women that you're working with, do you think that there's a sense from these folks, from your clients, that gender is a part of this conversation, or do they sort of have to be? I mean, do you have to kind of lead them into that conversation to say, listen, there's some other things that are at play here? I mean, do you find that a lot of your clients are already reflexive to say this? There's all of these other weights that I'm trying to bear out, or is this something that in your conversations, as you're talking, that you can kind of see these light bulbs go off, and people say, oh, there is this other complication, or there is this other dynamic that's there as well?
I think because most of my clients are women, and they tend to be about my age, you know, 30s, 40s, maybe some in their 50s. And they're juggling, you know, parenting and not not in a real parenting world. I mean, we're having to, as moms, we're having to make decisions about, is it safe to send my kids to school? Should I, you know, should I be feeding them differently? Are we eating healthy enough at home? Are they getting outside enough? So whereas before we were completely secure sending our kids off to school, knowing they were playing outside, they were being fed good food at school, you know, now I feel like a lot of that is on parents' plates. And as moms, more specifically as moms, we do feel like we carry a lot of that burden. So I do think that that women feel it in a much heavier way. And you know, I'm saying that because I'm a woman and I feel it, but you know, I do think that women are finding a lot of heavy things that we didn't feel before the pandemic. So
Right. Joya, let me ask a question, and this is by way one of your former faculty members is asking how you were doing, and I'm going to interpret that question a little bit deeper than just, you know, how is your Wednesday going, and ask you this question. I mean, you are you know, relatively new, not only to Parkland. I mean, it's still early in your career, relatively new to the practice of medicine beyond the medical education environment. How are you doing? I mean, have you found yourself? Did you find yourself prepared individually to deal with the kind of mental health pressure? I mean, some of the things Dara is talking about, unique to gender, but then there's another piece which I mentioned to both of you that I wanted to talk a little bit about, which was the idea that as minorities, there's also, I mean, already the research and the data tied to mental health and mental well-being in minority communities. I mean, there's still huge gaps. But I guess my question, Joy, to you is that in this first year, or as I guess now year plus, how have you managed with some of this? I mean, you had expressed even that idea of being so worried about taking the vector back to your family. But I mean, how are you doing, and how do you find yourself trying to strike this balance so early in your career with, you know, this pandemic that kind of looms?
Yeah, thank you for asking that question. So to start off, I think I was very well prepared to start intern year from Burrell. I was very confident when I started intern year relative to, I guess, as confident as you can be as an intern. I wasn't incredibly overwhelmed because I knew that plenty of interns before me had been in my shoes and gotten through the same rotations that I had. And so I felt good about that. I think the hardest thing for me starting intern year didn't actually have to do entirely with the pandemic. I think the pressures from the pandemic probably made what I was experiencing worse. But I think the hardest thing for me starting intern year and just kind of becoming a physician was seeing how mental health and just chronic conditions affect Black and Brown communities disproportionately at large. A lot of my patients that I see at Parkland, which is a large county health system, are minorities. And every day that I would go into work and I would see florid mental health issues, florid lack of primary care follow-up for chronic illnesses that then manifest and become much worse. All of these things affect people that look like me so much more than people who don't look like me. And so that in itself was very saddening to me. And there were multiple days where I would come home from work just feeling defeated and sad because I felt like I couldn't help them. And you know, we do the best we can to take care of our patients, but I knew that the issue was much larger than just me taking care of one patient at one time. And even though we try to train physicians to have empathy and recognize these things, when you're finally kind of staring at it in the face and patient after patient, you're seeing the same pattern, it just made me incredibly sad when I began intern year. And that's not something I was expecting to really feel. I didn't think I was going to carry that burden home. And I do think that the pandemic kind of probably compounded on that and made the stress worse than it probably would have been. But I think, like as time has gone on, I've kind of try to understand that, you know, we do the best that we can. We take the best care of the patients in front of us that we can. And then just advocacy for healthcare laws and just policy will really be where we can make a big impact if these are the issues that we really care about.
Okay, that's interesting. And I want to circle around with you in just a second to that, but let me jump back to Dara. One of the questions that came up in the chat was tied to the idea that women, based on current data, are disproportionately leaving the workplace, potentially as a result of the pandemic or managing some of these other pressures. Are you seeing some of that, Dara? Or are you have you talked to women that are at this particular moment? I mean, that as they reprioritize, or maybe they are in sort of a position where that pressure has changed. Are you seeing those kinds of shifts?
I've seen it a little bit. My community is pretty, you know, most people are working from home and now and having to also juggle if they have their kids home. My child, for example, still has in-person school, but they have them in pods, and it's a very detailed situation where if one child gets sick, the whole pod goes home. So it's very organized. But a lot of women that I see have children at home. And so they're either like pivoting if they have their own, you know, their own job, their own businesses in ways that they can still do that. Or they're moving to, you know, going back to school. I've heard several people, I'm going to go back to school so I can do something that's more conducive to being at home, or, you know, maybe changing jobs for a little bit and then going back. You know, I have a lot of friends who are teachers because I was a teacher, and there's a lot of fear in that. There's a lot of fear of, you know, what if I can't get the vaccine? I'm around kids all the time, you know? So I do hear a lot of that from teachers, that maybe it's time for them to either leave the profession, which is really sad because they're great teachers. But we've never seen anything like this before. So it's hard for teachers, as an example, to navigate where to go next or what to do. So,
right. I'm going to stick with you, Dara, because you and I were having a little bit of a conversation about this in our prep session. You grew up Mexican American, like I did, near the border down in Laredo. One of the things that we've talked a lot about is how culture and the linkage between culture and mental health has such intricate linkages. And one of those areas, one of the places we see that is in things like food, right? Food and culture, especially Mexican American communities, sort of turning to food not only as a coping mechanism, but also even as a subject of psychological guilt and scorn and advantage. And you know, Dara and I were talking about the idea that growing up, especially in my case with a Mexican American grandmother, you know, she would simultaneously be mocking you for being overweight, but then would be feeding you at the same time, right? Would be giving you more food, and there's this weird weird sort of imbalance that goes back and forth. But, from your perspective, seeing some of those challenges, I mean, what do you think? And some of this may be, again, beyond just the pandemic, but, Dara, what are you seeing in terms of how people are negotiating culture, maybe at this moment, or even with clients in the period before the pandemic, where culture does start to kind of intervene, or in some ways it becomes kind of the elephant in the room. Nobody wants to talk about, but quite clearly it's there. I mean, what have you seen from that perspective?
Mm-hmm. It's interesting because I have a client actually who has really taken control of her own health. She has decided that she's very self-aware. She's Mexican American, and that she listens to her body and eats the way that she feels best. But she has a mom who says, "You don't weigh enough. You don't eat enough. I'm going to make you tacos and bring them over every weekend, and you're going to eat them." That kind of thing. And so, culture plays a huge role in how we determine, how we're supposed to be eating. And one of the things I love to teach people is how to just listen, be intuitive, and listen to their bodies. They're so smart. Our bodies are so smart, and they'll tell us what they don't like. And so, we have to be careful with it's not really trauma, but sometimes it can be traumatic when our parents tell us how to eat, or what to eat, or how much to eat, and to do it in certain ways and for certain reasons, because we do carry those things with us into our adulthood. Still, even in my 40s, I can hear my mom saying certain things, so yeah, culture definitely plays into that.
Yeah. Joya, sort of a segue out of that same question, and again, I mean, some of this we want to anchor in this sort of overarching impact of the pandemic today. But I mean, as an immigrant, for example, I'm curious how you negotiated, or if this is a constant negotiation between the idea of culture as being part of your mental health balance, or if you're seeing something, especially with kind of the range of patients, if you're seeing culture pop up in those ways in terms of patient care. Because I do think, when we talk about the osteopathic approach, the sort of whole body approach, I mean, certainly you have, I think, some insight, especially negotiating, a particular kind of experience, and in this case, the immigrant experience.
Yeah, absolutely. So the biggest thing that my immigrant experience has contributed to the way I practice medicine is just first and foremost understanding that cultural difference makes a huge impact in how patients perceive their own symptoms and how they then relay those symptoms to their physicians. So the best example I can think of that's very like at the forefront of my mind right now is we have a very large Mexican American population here at Parkland and Dallas in general. So we get a lot of kind of middle-aged Hispanic women in the ED. And a lot of times if they're not feeling well, they'll describe that unwell feeling as feeling dizzy or sometimes nauseated. For us, dizzy and nauseated mean very specific things. And so if a patient is now saying they're dizzy and they're nauseated in the ER and they're saying like, "Oh, I just feel really dizzy," I'm worried about a posterior stroke, and I want to make sure they don't have that, because my job is to make sure that the most serious life-threatening thing is not happening right now. But I noticed initially when I started intern year that a lot of them would say that, and I would say, okay, like I would start probing them, but then they wouldn't really be able to describe this dizziness or this nausea very well. They don't really feel like vomiting, but they're nauseated, which didn't really make sense to me at the time. And then I realized this is just kind of a cultural thing, and I'm just interpreting it through my lens, but I have to kind of put myself in their shoes and see what they mean. Well, it's hard to do that if you're not familiar with the cultural background. And this is where diversity becomes very important, because I have a lot of faculty that are Mexican American. And so I had this very striking case was my faculty member had a probably middle-aged Mexican woman who didn't speak English. Her primary language is Spanish. He spoke Spanish. So they talked about her dizziness in Spanish, and he cued in to the fact that her dizziness was not the same as the general feeling of unwellness or just feeling bad. It was a very specific dizziness. And so her exam was a little bit okay. The CT scan initially was okay, but he knew that this dizziness was different based on his own cultural experiences and the way that she was describing her symptoms. So he got an MRI, and she, in fact, ended up having a posterior stroke. And so he sat me aside at the end of that shift, and he's like, Dr. Singh, like, I want you to take this as a teaching moment. She wasn't my patient. We just happened to be on shift together, but he was telling me that, you know, it's so important to take these cultural contexts, these cultural cues into context, and really pay heed to that, because it would have been very easy to just say, oh, it's fine, she's not actually dizzy because she's walking okay, you know. But he caught on to that. And so things like that are always on my mind, even before this episode, but especially more so after that. And we have patients from all different cultural backgrounds, and so it's really hard to know what symptoms mean what in specific cultures. But I think as long as we're aware of it and we're willing to take a step back and just question that things aren't adding up, that will be the biggest service we can do to our patients, because we're not just seeing their symptoms and their complaints through our own cultural lens.
Let me ask one follow-up question to that, Joy, because I think in the same way that you have this as sort of a teaching moment, and I think you've already clearly made some suggestions. I mean, what would you say to first and second year students in particular, as they're just starting to ingrain themselves not only in the osteopathic methodology, but also in just thinking about once they get their feet into the medical environment, how would you teach that? I mean, what would you say to them in terms of like an instructive approach to think about this particular point of diversity, and also maybe even just thinking about how patients would express distress in this way?
I think we're very lucky in that we're training in a region where we have a large Latino and Native American population. You won't get that most places in the country. So taking advantage of that and really listening to your patients, and like I was mentioning, kind of taking a step back to understand that the symptoms and the complaints that they're expressing, and see that from their cultural standpoint and learn from that. And I think when we are proactive about it and are cognizant about it, we're more likely to learn from it versus just passively listening to their complaints and letting kind of our attendings or the senior residents come up with a plan and come up with a diagnosis and just, letting them do that. I think if we are aware of that and using every patient encounter to learn from our patients, especially because we have a diverse patient population in New Mexico, that's the biggest thing that I think will serve them, and they'll be ready to see patients of different backgrounds no matter where they choose to go train after this.
It's fantastic. Dara, let me ask a question that actually kind of puts you in the context of your own experience with the medical profession. I mean, one of the things, having known you now for quite a few years, the frustration that you experienced with healthcare providers in terms of trying to say, it's this, here's the solution. If it's not working, we just don't know, right? And it put you in a position to have to not only be a much more vocal advocate, but ultimately sort of put you in the position to kind of shift the way that you thought about your own healthfulness and the way that you did it. From your perspective, and even maybe reflecting on some of the clients you've worked with, how do we change or have different conversations with patients, especially if there might be a sort of sense of, it's got to fit a model, and if it doesn't fit the model, then we just don't have a solution. I mean, what would you suggest from your perspective, both having been in that system, but then also now, working with the health and wellness coaching?
Yeah, that's a great question. And like what Joya was saying, it's so important to every person is so bio individual, and then you have to take into the cultural backgrounds too. But like for me, I kept going in and saying things like, I feel really dizzy, or I have these horrible headaches, and they weren't normal headaches. They were headaches that would stem from the back of my neck. And somebody who's a Lyme literate doctor, when I would start to talk to them, they knew exactly what I was talking about. But if I'd go into the emergency room or to a general practitioner, it was, you're dizzy, you have a headache, maybe you have anxiety, try, maybe you're depressed, maybe you're just tired, maybe you're a new mom, maybe you just need more sleep. So I experienced a lot of that, and it is very, very frustrating. And one of the things that I do when I meet with clients is I try to look at everything. How are you moving? What are you eating? What do you, and looking at that whole approach that I feel was really just not ignored, but they were looking at more clinical symptoms as doctors, like you say, to maybe fit into certain molds rather than looking at the whole experience. Not one person asked me what I was eating, or have you tried to change your eating, or have you tried to take out, have you thought about food intolerances, or I had to figure all those things out on my own, without a medical degree, just by researching and trying different things on my own. And so now I know to ask people those questions. Obviously, if there's something medical or clinical, I always refer them out. But I start with things like, what does a normal day of eating look like for you? And if something's happening chronically over and over and over, well, if you're eating this one thing every single day over and over and over, let's talk about maybe what might be happening with your food, things that I think that, if I'm honest, medical professionals might not have the time. They might not have the resources. They may not have. And so as a health coach, I love that maybe we're going to be able to offer that kind of in between position where a doctor could say, this person really needs to look at the way they're eating, or let's look at how they're managing their stress. I can tell this mom is under a lot of stress. What can you do to help her with some action steps? And someone like me as a health coach, I can help them with those tiny habits that maybe we can start cultivating and integrating, that maybe a physician doesn't have time to do in an office, to express in an office. So
right, no, that makes a lot of sense. Well, let me put the question back to you. What's a day of eating like for you? Like, how was your day today?
So I used to skip a lot of meals, one because I was teaching, but now I'm focused on balanced meals. At my age, I really try to balance my blood sugar. So, I eat 5 or 6 small meals, make sure there's protein, healthy fats, lots of fruits and vegetables. What I know now, things like, to stay disease free, to try to stay disease free, we should be eating, at least 5, but ideally 9 cups of fruits and vegetables a day. I mean, I don't know a lot of people who do that. You really have to be intentional about planning your meals to be able to do that. And so, but I've noticed a lot of changes in things like dissipation of brain fog and digestive issues. And I don't take any more allergy medications. I took those all my life. And just by changing some of these things, and the things I was incorporating, plus I do a lot of mindful exercises and yoga and things like that, incorporating those things. But a lot of people don't know about those things. And unless you go to a doctor who has time to talk about them, or the doctor refers them out to somebody like me, how do we, especially people who are, maybe in lower socioeconomic areas, or don't have access to those types of things, it'd be great to be able to offer that in communities everywhere.
Joya, let me jump from that question to you in very similar sort of fashion, because and some people may have watched Joya's videos that she did for Burrell, kind of a day in the life of an ED doc, and those were circulating through Burrell social media a couple of months ago. But I was struck because at one point I think you went into the break room, and as part of maybe like a community thank you to the medical professionals, there were just like boxes of like snacks that were lined up against one wall, and it was thinking like chips and granola bars and all kinds of stuff. So I mean, sort of a variation of the same question I was asking Dara. I mean, what's your how did you eat today, and how do you find balance? Because I would also imagine that between sort of this is an embarrassing question, but between sort of the peaks of kind of stress and riding out just sort of what a day for you is like. I mean, how do you manage that? And then maybe as a segue to a second part of that question, what do you do that helps you find kind of this balance? I mean, when it comes to, you talked about the idea that at the end of some days you go home and you're just really, it's all sort of on your shoulders. What do you do to break that out? And what would you advise, again, some of these, especially first and second year students? I mean, how do you do it? How do you manage it?
I was really hoping you wouldn't ask me that question after you asked Dara. I was like, oh man, how am I going to answer this question? Because this is not a bill of health. So residents notoriously are the worst at we don't have time to make healthy foods. We don't meal prep. We eat kind of the stuff that you saw in my video. So, but with that, all that being said, I'm lucky that I live at home. Great life hack on my part because my mom cooks. So Nepali food generally is pretty healthy. I think the most unhealthy thing that we eat is rice, which has a lot of carbs. But if you just cut the rice, then it's a lot of vegetables, only a lot of lean meats like chicken, which is also kind of rare. I'm trying to get my parents to not eat any meat, so we've cut that out too. But just lots of vegetables and curries and spices cooked in these vegetables. So normally, if I eat at home, my diet is okay. If I'm not eating at home, then I try to get like a chicken wrap or like a veggie wrap at the hospital. But sometimes if I'm working like a 16-hour day, there's no way I'm going to eat a veggie wrap at the end of a 16-hour day. Like I'm going to eat something that makes me feel happy inside. So that's what most of us do. There are some of my co-residents that are very on top of it. Like they have wives who like meal prep for them, and like they bring all these like healthy food to work, and they'll like maybe eat that. But I think the worst thing about being a resident, especially in a pandemic where you're wearing a mask and you can't just like snack really quickly, is that we just don't have the time, and a lot of us aren't making enough money to really purchase like meal prep services. And so when I speak for like all of us collectively, we just don't really have the time or the resources, and it's unfortunate. And I don't think it should be like that, especially because we work a lot, averaging 70, 80 hours a week. It's not good that we eat the way that we do. But I think a lot of us though are trying to stay healthy in our own way. So some of my co-residents go to a spin class that's like socially distanced, or they do a spin class together in their own apartment complex that has a small gym. I do P90X, so I only do half of the video. They're like 90-minute videos. I do like half of it because there's no way I'm making it through a 90-minute video after a shift. So I try to do that just to kind of keep myself fit and robust as well. Working out definitely helps ease the stress. I play tennis sometimes when I can. I do that as well. There's just a few little things that I do, but overall diet is no bueno.
Well, that's okay. I didn't mean to put you on the spot, but it was when I talked to Dara, she had just finished demoing or was talking about doing a particular meal, and so that's what got me thinking about that. Dara, Dara, back to you, and I think this is also a good way to kind of talk about this. I mean, you work with a lot of high-paced and substantial professional women. I mean, like Joya. If somebody is balancing a high-pressure career in a way like this, or as some of these medical students will, especially as they get into their third year, they start getting the experience in the healthcare field. If you had a female client, what is the place that you would start and say, well, look, if you can't do this, if you can't do this whole menu, here's the place that I would start, and here's the place that I would really think about that. Is it trying to seek mindfulness as a strategy? Is it the food piece of the strategy? Is it exercise? I mean, and again, sort of operating in the assumption that your potential client is really, has space for something, but not all of the things.
That's a great question. A lot of people would think that it would be food, food or exercise. I always start with sleep. And I don't know what sleep is like for medical students. I'm sure it's you guys are up crazy hours, but sleep, as you know, is what repairs the brain, and it really allows, when your brain works, everything else usually works as well. And so I always start with sleep, and I say, 7, 8, 9 hours if you can, at night. That's the number one thing. And if you can't get them at night, try to fit them in during the day, even in small spurts, 20, 30, 40, just to give your brain a rest. Because especially right now where we're staring at screens, and when we're not staring at screens and we're talking to people, we have masks in front of us. It's very overstimulating for the brain. And so those short rests for the brain during the day, and then a good sleep at night. And then I would say, as best as you can, fitting in just those small snacks. And I like food combining, because I like, being able to combine protein and a fruit, or, apple butter, apple almond butter with apples, or things like that. Small things that, they don't cost a lot of money, but you can put them together pretty simply. The sleep is free, obviously. Exercise for the most part is free. And the best kind of exercise that's really underrated is an outdoor walk. Taking a walk outdoors, you're moving, you're getting fresh air, you're clearing your mind. And ideally, you wouldn't be looking at a screen while you're doing it. I still see people taking walks and staring at their phone. But even things like just taking a few minutes in the morning and writing out your intention for the day. That's free, really getting in a place mindfully where you can set out and do things that that bring you joy, and maybe writing just a few things you're going to plan to take with you to eat, so that you're mindful of that as well. I could come up with 100 things if I was sitting in front of somebody, actually, but and again, everybody's different, so the needs are going to be different. But things like taking a multivitamin, uh, just things that enhance your brain function and lower the stress are going to be so important right now.
One of the questions for you, Dara, is would you think positively about something referred to as a 5-2-1-0, 5 servings of fruits or vegetables, no more than 2 hours of screen time, 1 hour of exercise, and 0 sugar sweetened drinks? Does that sound in your wheelhouse?
Fantastic. That sounds fantastic. Yeah, I had never heard of that, but that sounds really good. Yeah.
That's fantastic. That's good. Joya, let me ask you this question, because I think, again, with the audience that we have, with the number of students and even faculty, I mean, you've already referred to a little bit about some of the challenges and thoughts about just diversity and how that impacts your day-to-day job. But these students now are not only going to come up and out into a system where the pandemic is largely going to be, I mean, it's going to loom large probably for another 5 or 6 years, especially for the medical profession, right? I mean, even with vaccination rates, I mean, our best projections for when we'll get physically back to, kind of normal is still pretty far off. So what is your best advice now that you've had some time at Parkland for this new crop of students that are going to come out as docs? I mean, and specifically about dealing with the pandemic, is there a bit of advice that you want to center around them as individuals? Is there a piece of advice that you would offer up to think about the patients differently? What would you say is your best kind of a piece of advice at this moment for these medical students, but then also for the medical faculty? We obviously have a lot that are on here. Quite a few fans of yours, by the way, as you noticed in the chat. Lots of people very proud of you. But what would be the thing that these students are going to need to know or need to think about that's different than your class or maybe medical students, a generation ago?
The biggest thing and the most important thing that I would tell medical students is be gracious to yourself. You really, really have to start learning how to be gracious to yourself as a medical student. Residency is very different from medical school in a sense that your time is not your time anymore. When you have to report to work, you have to report to work. And unfortunately, the way our medical system is designed and the way medical training is designed, you can't just take off work for a wellness day, even though I wish that were a thing, it's not. And so you have to try to find whatever it is while you're still in medical school and you have the time. I know you probably feel like you don't have the time, but you have the time right now to figure out what it's going to take for you to kind of center yourself, have some time for self-reflection, even if it's 10 minutes before bedtime. Find whatever it is that you need to do to kind of forgive yourself for any mistakes that you've made during the day, forgive yourself for not knowing some of the things that your faculty may have called on you in class, anything that might have negative that might have happened during the day. Find whatever method you need to kind of recoup from that and center into why you wanted to be a physician in the first place. Don't lose your passion. And most importantly, just be nice to yourself and love yourself more than anything else, because in residency, you're going to go through so much. There's so many changes. You're not going to know everything. And if you're someone that has very high expectations of yourself and is very hard on yourself when things don't go as you expected it to, it's going to suck a lot, especially during a pandemic. So just find that now as a first year. That's one of the best things I probably did for myself starting medical school, and I carried that on through residency. And that's probably one of the reasons that I have time to do things like this, and I'm happy and I'm not overall just like burnt out from medicine, because working in this pandemic definitely would have burned a lot of people out. For faculty members, what I'd like to say is I would definitely encourage you to reach out to the medical students to see how they're doing, and definitely try to form mentorships with them. Dr. Cyrus was my mentor in med school, and he was phenomenal. Anytime I needed anything, I knew I could just call him and he would be there for me. I knew I could even call his wife and she would be there for me. And just having that relationship with a faculty member is just invaluable. And if you can make that difference in either one or two medical students' lives, like, you have really touched their lives in a very significant way. And Dr. Cyrus is still one of my favorite people, and I'm not even at Burrell anymore. So I would encourage you to do the same thing for your students.
Fantastic. And Dara, one last point to you, just to see if there's a way for folks to connect with you. How do they go about doing that? What's the easiest way? Is it through socials, or where is your presence sort of the most evident?
I do have social media pages on Instagram. It's dparker_wellness. And then I am on Facebook, and my website is daraparkerwellness.com. And I do offer a no-cost wellness breakthrough session, just to do kind of like what we talked about. Hey, tell me what's going on. What are some of your concerns? And I try to offer that for maybe people who just want to explore maybe what might be going on, and then I can tell them, hey, you really, with digestive issues or things like that, you really need to see a physician, or there might be ways that I can help them, or another health coach can help them. So yeah, I strongly encourage everyone to have a health coach that can hold them accountable, and encourage them to make healthy and lasting choices. So
fantastic. Well, Dara Parker, Dr. Joya Singh, thank you so much for spending an hour with us. Really fantastic insight, Joya. Obviously, based on the number of folks that are commenting in the chat, they're incredibly proud of you, and we're certainly glad to see you carrying the Burrell name at Parkland, and wish you both the best of luck and, of course, health as we enter 2021. We will be back with another diversity session next month, and until then, thank you so very much, and have a great evening.
Thank you so much.
Bye-bye.